But what's important that I would like to tell the Kenyan public is the fact that we have had an upsurge in non-communicable diseases in our country, notably cancer. But not just cancer, we have quite a number of people also who need palliative care either because they were involved in accidents and they have not been able to recover fully and may need to be taken care of. And there are many conditions that may necessitate that the patients are given the care that they need. Now, palliative care, as we all know, is a fairly old discipline, but has not been really integrated in our healthcare system, and that's why conferences like the past 5 that we've had and this particular one today would seek to ensure that healthcare providers actually integrate palliative care so those who are suffering from ailments that require that they get that level of help in their setting or in the hospital setting, get that very service. Now, you must have heard about the centers, that, and the experts are here. And I know that Kisumu, we do not have a hospice. Okay, we used to have one, which was closed during the COVID-19 pandemic, which we have committed as a county to be able to reopen, so that those who need palliative care this side of the country in this region can be able to get that very help.
It's the 6th palliative care conference being held in the country, and as the DG has said, it's the first one being held outside of Nairobi. And it is critical that it's being held in Kisumu, because we've realized that we need to go out there and make sure that people understand what palliative care is. Because it's an approach that takes care of patients and families when they are facing life-limiting illnesses. An illness that will make a patient seriously suffer and also change their activities of daily living and what they are used to doing. And the importance of the patient, the importance of the family, the importance of the community cannot be overstated. Because palliative care is not only provided in the hospitals, it's also provided in the communities, in the patient's homes, and it encompasses a team led by the patient, family members, spiritual leaders, community leaders, people who do advise patients about what type of food to eat, and also other stakeholders in the patient's lives. And as the field grow, you must also realize that you as the media and everybody else who listen, you become very critical advocates for the growth of palliative care. In a country where about 1% of the population require palliative care at every given time, and out of that population that require palliative care, only 10% are able to access this critical service, we are called upon, the onus is on all of us to talk about it and to make sure that the patient and families who require it are able to access. Palliative care is not only about giving strong pain medications. It's not only about giving and dealing with pain and all that. It's about the holistic aspect of the patient. It's about physical, it's about socio, it's about emotional, it's about cultural, it's about socio, and it's about family interrelationship.
Jina langu ni Daktari Elias Meli. Mimi ni mkurugenzi mkuu wa taasisi ambayo inahusika na matibabu ya mambo ya saratani katika nchi yetu ya Kenya. Tunavyojua katika dunia mzima tunahitaji huduma ya palliative care, na watu zaidi ya milioni 40 huhitaji huduma ya palliative care. Lakini katika nchi yetu tunajua kuwa ni jambo jipya, hata ingawa tumesisitiza kwa muda mrefu. Leo hii tungependa kudhihirisha kwa kila mmoja katika nchi hii kuwa kwa sasa hivi huduma hii itapatikana katika hospitali zetu, itapatikana katika zahanati zetu, na hata itapatikana katika vijijini mwetu. Tunashukuru serikali hii kwa sababu ya wale community health promoters ambao tunajua wao ni wale wahudumu wa chini katika huduma ya afya. Palliative care itakuwa mojawapo ya huduma ambayo wao wenyewe wataweza kuhakikisha nchi yetu inapata. Mimi katika taasisi inayohusika na saratani katika nchi hii, tuko na nia ya kuhakikisha yule anayegunduliwa kuwa na ugonjwa wa kansa, wa saratani, kutoka mwanzo lazima aweze kupata huduma hii ya palliative care.